Well, warm welcome to this talk. Now, it's good to know that there are some vestiges of democracy left on our terrestrial globe. We learned from Port Hedland a couple of weeks ago in Australia that the local council there had decided to write a letter to all the doctors in the area to inform them that they had to give a sort of a risks-benefit analysis to patients before they were given the COVID vaccine, so they could give proper informed consent, being aware of the risks of the vaccine. And I believe that this has been rolled out to all the councils in Australia now, so that's remarkably encouraging from a local level. And I've also learnt of an initiative from Idaho, which I want to share with you, in the United States, of course, top left-hand corner as far as I remember. I think is it the state just to the west of, just to the east of Washington State, I think. Anyway, excuse my American geography. Idaho Health Board, first in the US to defy CDC and FDA by removing COVID vaccines from clinics. Now, this is the article here. It's not a technical scientific article. It's eminently readable. Do read it. Published in the Defender. Just full of basically, completely intelligible suggestions and claims in this article. And we're going to look at this, and you can let me know what you think. Well, let's get down to it. It's the Southwest District Health Board in Idaho. These are the references here. That's the main reference there that I used to compile this talk. Always put the references in, of course. 30 locations, 6 counties to stop promoting the COVID vaccine shot. So this is a Southwest District responsible for these 30 locations. So there we go. They're basically going to pull the COVID vaccines from these locations. It's still going to be available for people that want it, but we'll see that as we go through. Mary Holland, Children's Defence Chief Executive Officer, after hearing from 300 constituents, so a lot of people clearly voicing concern. And again, this is remarkably encouraging. We've got local people here voicing concern through local democracy. Hard to see how that would work in my great country with the mother of all parliaments. Hard to see how that would work at all. But working in Australia, working in Idaho, and Idaho could well be a model for other parts of the United States to follow. So this is remarkably encouraging for these countries. Listening to well-informed physicians. So this is well-informed physicians giving information. And assessing the public record. The Southwest Idaho Health District Board made an informed decision not to stock its own clinics with COVID-19 shots. If residents want one, they can obtain the shots from doctors or for other doctors and pharmacies, just not from the ones run by the health authority. Now, this is good. People are still being given the choice. People have not always been given the choice, but here they are being given the choice. This is from Dr. John Tribble, the board's physician, or the only physician on the board. The people of this district were demanding answers. And this is true in many places of the world. I know that a lot of people watching are demanding answers. Many came forward with heartbreaking stories of vaccine injuries. Now, we have interviewed people with absolutely tragic, life-changing vaccine injuries on this channel. A few years ago, that's what basically started to enlighten my thinking, that the mismatch between what the authorities were telling us and what these poor patients were telling us as they suffered terribly from vaccine adverse reactions. We have to listen to our patients. You are basically no good as a healthcare provider if you don't listen to your patient. What are your patients telling you? If you're not going to listen to your patient, go off and do something else. Healthcare providers, we have to listen to what our patients are telling us. Fundamental, axiomatic, and yet so often simply not done. Go figure that one if you can. The evidence clearly showed a lack of safety and efficacy as it compares to the risks from COVID-19, so the risk-benefit analysis, and the board members' decision reflected that. I believe this is still Dr. John Tribble talking. I believe our actions here stand as an example and precedent for other health agencies to take back control of their health freedoms. So hopefully this will get other boards around the country and people thinking. From a corrupt federal system. That's the claim being made. Let me know what you think. I couldn't possibly comment, of course. A corrupt federal system. Very strong words indeed. If there is corruption, we don't want it. Corruption needs to be rooted out. We need honesty, not corruption. More to come on that, maybe in the next video. I've been working on something else, but let's stick with what we're doing for the moment. I hope this will inspire other health agencies to openly discuss the issue and evaluate the evidence for themselves. That's all we're asking. Evaluate the evidence. Follow the evidence wherever it leads. Test all things, the Apostle Paul said. Test all things. Hold fast that which is good. Look at the evidence, test it, evaluate, use this brain that we've been given here, use our experts that we have, and let's think for ourselves rather than accepting the dictated, authoritarian, top-down decisions from on high. We have to cherish our individual freedoms of thought. Laura Demaray, Southwest Idaho resident and nurse who attended. Many federal agency leaders are captured. Now, I've left the hyperlinks in here. That's the hyperlink from the article in the Defender. Look at it yourself and decide for yourself if there is capture. By industry. Many federal health agency leaders are captured by industry, according to Ms. Demaray in this article. But that's not the case with most local level health officials. So local level is good. I feel strongly that decisions should be taken as near the people as possible. Democracy needs to be ground up, not top-down dictatorship. If a decision is affecting people in my area, the decision should be taken by people primarily in my area. It's the principle of subsidiarity. Decisions should be taken as close to where they're being operationalised as possible, in my view. Now, of course, it's not always possible. We think about national defence. But as a principle of democracy, I think that's a good one. Let me know what you think. She goes on to say they aren't all bought out yet. So talking about the local authorities aren't bought out yet. Let's hope they never are. If you bring your local doctors like Dr. Tribble, and then there's various other doctors mentioned, look in the article for yourself. If you bring them and they make presentations, it's a public record and your community gets to see that. Democratisation of knowledge is the principle here. Knowledge needs to be democratised. Ordinary people who are being influenced by decisions should be informed as to the underpinnings of those decisions to evaluate their scientific medical efficacy. And this is true for all interventions. Local people should be informed and deciding. That's how you can open up a can of truth. Let's hope cans of truth are opened up all around the world on this and many other issues. Mary Holland, again, Children's Health Defence League CEO. Sadly, people need to accept they cannot trust federal government anymore when it comes to their health. Let me know what you think. Do you think federal government can be trusted? If you're in the UK, can our national agencies be trusted? Let me know what you think. Nicholas Hushler. Now, Nicholas Hushler is an epidemiologist at the McCullough Foundation. We've had the privilege of talking to Nick a few times on this channel, actually. And my impression was one of a very thorough scientist, I must say. It's a while since we've spoken, but we talked a couple of times. Evidence was presented in a very cogent way. So he's commenting on this. Southwest Idaho Health District made the correct and brave choice to remove COVID-19 injections from their clinics. Nick is saying the updated boosters were never tested in humans, while previous iterations have demonstrated they are not safe for human use, is Nick's view on that. Also from the article, it says, as of the September the 27th, there were 1,604,710 vaccine adverse events reporting system, VAERS, the US equivalent of the yellow card scheme in the UK. There were 1.604710 reports of injury or death following COVID-19 vaccinations. And the article also says VAERS has historically been shown to report only 1% of actual vaccine adverse events. Now, if they're only reporting 1%, you don't need me to tell you what that times 100 is. You stick a couple of notes on it. I've talked to many people who've made complaints of various conditions after they've been vaccinated, and very often not linked it as potentially related to vaccines. The cognitive linkage has not quite been there, even although I've talked to many people who have conditions which now we know more, it's highly suggestive that that could be the case. But yellow card systems or VAERS reports were not put in because they often didn't think there was a link. There may not be a link, that's the whole point. You put the data in, and then national trends can emerge. But heck, if you put 2 noughts on the end of that, you get to 160 million. Dr. Don Tribble, the board's physician again. People need to understand that these shots are not vaccines by the traditional definition. That's what misled me, just the use of the word vaccines. By the traditional definition, they are not. They are not. Traditional vaccines give antigens. These give the instructions to make antigens. That is to say, they do not impart immunity or prevent transmission, he says. They were rushed to market, given legal immunity, and coercively pushed on the world's population, backed by unfounded fears spread by government and media. This experiment with mRNA gene therapy, well, it's giving messenger ribonucleic acid genetic instructions. So I think that's a fair description. During COVID-19 will be shown to be one of the most egregious examples of in world history. Now, I've got quite a few other things to say from the States. I think I'll leave that now. I've been meaning to play you this poem written by Mr. John Bow for quite some time, so I'm going to play that now. Mr. Bow is a famous English actor, and actors are so clever the way they do things with a voice. I just sound like a bumbling amateur. So let's listen to the poem now that he wrote, and he recites it. Thank you for giving us permission to share it, John. Let me know what you think. But for now, thank you for watching.
The fog. The fog has descended. Black fog. Black dog. Heavy, dense, damp, drenching us. Needles piercing us with fear. Bodies, lurching in the black, sink into the murk, pass into the dirt. We do not see. Voices reassure us. Words with papers and badges, knowledge with degrees and diplomas. Elevated to guide us into the fog. Privilege pushing us deeper in the bog. Don't ask where we went. You won't see the numbers. You must not see the data. Must not see the facts. Maybe later. Don't ask what this vaccine is. Don't ask what the dangers are. Walk on in the fog. Walk on in the dark. There is a hand. There is a light. Take that hand. It leads you from that night. Then look around. See what was always meant. Don't ask where we went.